Of course, you mentioned NF-kappa B inhibition. The first agent, of course, we were looking at believing that might have a role was Bortezomib in terms of its mechanism of action. Maybe a drug that was a good idea, but which better pathway inhibitors have come along, and maybe from what Jeremy was presenting this afternoon, intriguing data, but not enough to believe that it could compete with some of these more novel agents. Is that how you kind of interpret the Bortezomib data, or do you think it still has a specific role in some subtypes of lymphoma?
Right. Well, I can say that for large cell, when we started our studies, there weren't very many drugs out there, targeted agents, and I use that very loosely when it comes down to proteasome inhibitors that could potentially modulate NF-kappa B. And the way Bortezomib presumably did it was that it inhibited the degradation of phospholipid kappa B, which then kept the NF-kappa B in the, out of the nucleus. And in a proof of concept study we did, and we really meant it as a proof of concept study, there was some intriguing evidence that it may sensitize ABC tumors to chemotherapy. And so we really meant it as a proof of concept. And I would agree with you totally that within large cell, I think we have much better ways and more potent ways and less toxic ways of modulating NF-kappa B. And we've already discussed two of them, ibrutinib and lenalidomide, because activation of NF-kappa B is the terminal terminal pathway that comes down from BCR signaling and toll-like receptor signaling. So yes, I think it was an interesting proof of concept, but I don't think that it's something that it will probably ever see the light of day for large cell. Bortezomib was combined in a randomized study with R-CHOP. In this case, it was with mantle cell. And there actually was a significant positive clinical effect on progression-free survival in mantle cell. And it raises the specter of whether or not you would want to use it in combination in that disease. I certainly think it is a very good option, but as we saw before, ibrutinib, lenalidomide, idelalisib, these are all agents that have activity in mantle cell, and I suspect that as we get more experience with them in combinations, that they will probably be, in my view, better ways to modulate BCR signaling and the end effects of that, and less toxic. So maybe in the near term, we'll see people combining Bortezomib with R-CHOP for mantle cell, but I think it's going to fall by the wayside the way I think it's already fallen with large cell.